Now on Newsline, Republicans say President Biden's Justice Department is protecting his son Hunter, but he is not alone. They say the DOJ is also protecting one of the top officials at the Department of Health and Human Services. And our national correspondent Logan Raddick joins us live right now from Washington, D.C. with the latest on this. Good afternoon, Logan.
Good afternoon, Bianca. The Justice Department is a party in a lawsuit against Alabama over a state law that blocks sex changes for minors, which makes some federal agencies prone to discovery. Now, the DOJ tried to block a FOIA request for records related to Assistant Secretary for Health, Dr. Rachel Levine. Alabama Attorney General Steve Marshall requested Levine's records, saying, quote, "It is not hyperbole to say that Admiral Levine is the leading public-facing official in the United States when it comes to transitioning treatment for minors." According to a court filing, the Justice Department would not turn over Levine's emails, but it did provide emails of one of Levine's subordinates. Marshall says Levine, quote, "routinely endorses puberty blockers and cross-sex hormones for minors, while overseeing HHS's federal guidance endorsing gender-altering procedures for minors." Alabama's Attorney General is defending litigation against his state's law that makes it a felony punishable by up to 10 years in prison to prescribe puberty blockers or hormones to children. Now, the Justice Department argues that Alabama's law, quote, "denies necessary medical care to children based solely on who they are." But so far, the DOJ is not commenting on why it blocked discovery of Dr. Levine's emails. Bianca.
Very interesting. All right, Logan Raddick, appreciate it. Good to see you. All right, so let's talk a little bit more about this. The DOJ intervening to protect Dr. Rachel Levine, again from discovery, raising important questions about the role of federal agencies, of course. So let's bring in our panel now to discuss this. Standing by for us today, we have Brandon Straka, founder of the Walk Away campaign, and also Jacqueline Toboroff, author of the book Supermoms Activated. She is also writer and editor-in-chief of the Manhattan Contributor of Human Events. Great to have you both in this Labor Day. Thanks so much.
Thank you.
Thank you.
I'd like to get your reaction. I mean, Supermoms activated over the hiding of information here when it comes to these minor surgeries. Jacqueline, first to you as a mom here. I'm disturbed because we know that the hospitals want to make money off these.
Yes, we even heard Dr. Rachel Levine say that she was happy that she waited until after she had kids. This is sexual abuse. This is sexual exploitation of children. This is what is activating mothers, as you say, from all different socioeconomic backgrounds and both sides of the political aisle. This is really disgusting and disturbing. And what it does is it ensures that these children are not only seated with doubt, they might never be able to procreate. And it's really tragic. It's the hobbling of the nuclear family, brought to you by the Biden administration and helped by the DOJ.
Yeah, I don't really think she's the epitome of health. I've always been concerned, like, why is she in that position as well? I think that this is part of the narrative with this administration. I mean, these are surgeries that, as Jacqueline just said, you don't come back from some of this, Brandon, and even some of the stuff when it comes to puberties, you know, that she said something about wrong puberty. You can't have wrong puberty. I mean, this is like an alternate universe these people are living in.
Right. And, you know, what other medical issue, with the possible exception of COVID, is shrouded in so much secrecy, you know, and so much cover up that's going on. And the thing that I find the most disturbing and that we rarely ever talk about is the fact that there are so many kids. There's this enormous spike within the last couple of years of young people who are now identifying as transgender, because there is absolutely a social contagion aspect of this that people are feeling like they're being messaged to, they're being marketed to. I mean, they're being told, look, do you feel awkward? Do you feel uncomfortable in your body? This is probably, you know, the answer to all of your problems. I actually went to Pride in New York City just this last summer. There was an inordinate amount of girls there. And when I was talking to them, all of them were identifying as transgender. And I said to them, well, when did you discover that you were transgender? The majority of them said, oh, when I was in high school, when I was in middle school, I had 15 friends. We were all trans. Well, you take that and then you've got this, you know, secret medical, the medical industry secretly trying to push through puberty blockers and things like this. Is a very disturbing trend.
It is. And, kids are vulnerable, right? And it's already a confusing time for them. And, if they don't feel like they fit in, I think that's where they put in some of this messaging, Jacqueline. It's almost like, oh, now you can have this to kind of to bond with your friends, to go off what Brandon says. If people are saying no, they feel like they belong here. And then they're leaving parents out of the conversation as much as they can. The school doesn't want you to even know what's going on with your child. It's insanity.
That really is part of what is happening here. New York State Department of Education has said that they are going to focus this coming school year, actually that's tomorrow, on gender affirmation. They will be looking to transition preschoolers, that's 2.5-year-olds and up, and conceal it from the parents. The number one book this summer, 1.7 million members of the largest teachers union, Randy Weingarten, is Gender Queer. This is what 1.7 million members are being told, mandated to read over the summer. This is what our children are coming back to.